Before starting the assessment, you want the patient to be rested for 5 minutes. Ensure that the patient has not consumed any caffeine or nicotine 30 minutes prior. You then want to have your patient uncross their feet and sit with their back supported to the chair. Roll up their sleeve to prepare the placement of the pressure cuff. Place the patient's arm at heart level and check for their pulse. Ensure to use the proper cuff size. The proper cuff size would be between the two white marks. If it is too small or too big, replace the cuff with the proper size. You then want to place the cuff around the patient's arm, lining up the artery mark with the brachial artery. Now, to check your stethoscope, make sure the prongs are facing away from you so that they can enter your ear canal properly. Then, you want to lightly tap on the diaphragm, placing it onto the brachial artery but not directly under the cuff. Grabbing the bulb, you want to tighten it all the way to the right and begin pumping to inflate the cuff to 180 or 200 millimeters of mercury. Once you have reached the correct pressure, you want to slowly undo the valve at a rate of 2 to 5 millimeters of mercury. The sounds you will hear for are named crotch coughs. The first sound you should hear will be the systolic pressure. The systolic pressure is the highest pressure during the contraction of the blood vessels in the heart. The diastolic pressure would be the very last sound you hear before it fades into silence. The diastolic pressure is the pressure in the arteries between the heartbeats when the heart muscles are resting and refilling with blood. To do a second reading, you must wait at least 3 to 5 minutes.
The following chart explains the categories from normal to hypertensive classifications that adults can range in. A normal blood pressure for systolic would be less than 120 and less than 80 for diastolic. To be considered prehypertensive, your systolic would need to be 120 to 129 and less than 80 for your diastolic. Stage 1 hypertension would be 130 to 139 for systolic and 80 to 89 for diastolic. Stage 2 hypertension would be 140 or greater for systolic and 90 or greater for diastolic. In hypertensive crisis, the systolic would be greater than 180 and the diastolic would be greater than 120.